Well, listen, let's talk some sports medicine right now and bring in our good friend, Dr. Joe Congeni, of course, Akron Children's Hospital Sports Medicine Center. Joe, what do you have for us this morning?
Gosh, Ray, this time of year we could go about any direction sports-wise, really. It's kind of a fun time of year. I think the weather really kind of finally breaking. We're out seeing the spring sports kids finally get their time in the sun, and hopefully it stays sunny and that they're out there. But yesterday, a lot of people say, what the heck are you doing, stay in your office where you see patients, but I still go to high school clinics in the training room one day a week. And when you get out there, it's kind of more of a raw deal. I mean, it's not like people have already seen their doctor, been to ER. You really get to see it, coming right off the track or the lacrosse field or the baseball diamond. And one of the injuries I saw much of yesterday is a lot of the runners have gone out and started to run for track season. And so they naturally do too much too soon because our weather is pretty bad, and then all of a sudden it turns pretty quick, and they have meets coming up pretty quick and things. And one of the very, very common things, we sometimes talk about some of the new cutting edge or more complex things, but one of the real common injuries that I don't believe we've talked about in a long time is a thing called iliotibial band friction syndrome, or iliotibial band tendonitis. Iliotibial band is a long, thick tendon band that runs down the side of the leg, and it's just so common, and not having talked about it in a while, high school kids get it, college kids get it. Adult runners get it very, very frequently. So IT band, everybody talks about IT band, and the IT band runs all the way from the crest of your hip on the outside of your leg all the way down to just below the knee. And because it's a thick, strong tendon band, it will start, for some reasons, with runners to rub in two bony areas. So on the side of your hip, we have a bony area that you can feel, kind of almost back-headed towards the buttocks. And further down by the knee, there's a bump that sticks out just above the knee. And this IT band will really bother runners. They have to stop running. They're having a lot of pain there. And really, there's four things it's due to. Number one is overuse. So a lot of kids haven't run a lot in a long time, or they start running meets or running more distance, the muscles fatigue, and that band starts to rub, and they have an overuse injury with IT band. Number two is it's very mechanically driven. So kids who actually have a lot more of where they're loading the outside part of the body more get a lot more problems with IT band. It's very much related to the mechanics of how they run. Number three is what surface they run on. So getting outside, if you're running on a road that is banked or canted at all, the lower leg will be the leg that actually where you'll usually get the IT band. And footwear, as the shoes wear out. A lot of people are trying to get too much mileage out of old beat-up shoes, and the foot will roll out, and it will cause this band to get very swollen, tender, painful, and kids just cannot run, and they're really beside themselves. Adult runners, too. And it's something that's fairly easy and simple to treat, and that's why it's something I wanted to talk about today. Much of the time, people can cure it without even going to physical therapists. A lot of our trainers and other people can show people the appropriate stretches that they can do to get rid of this IT band tightness and soreness and pain on the side of the leg. One of the big hot things in the last 10 years are these foam rollers. So any gym you go to have these foam rollers, and a lot of athletes like to roll out that band, and it really feels like they get a good stretch, and they do some icing and stretching and maybe a little bit of anti-inflammatory medicine. We don't use as much anti-inflammatories, not nearly as much as we did a decade ago. But those kinds of things help most people get better. With the second most common runner's problem is called iliotibial band friction syndrome, or IT band syndrome.
Yeah, Joe, I had problems with that band last summer with all the walking that I was doing. Changed my shoes, backed off a little bit on the walk, and literally it took about a week or so, and it left. But you're right, it's wear and tear. And I had a real bad, it was really aggravating me down by that knee on that bump that you were talking about.
Yeah.
But I changed my footwear and changed my shoes, backed off a little bit on the miles, and it took care of itself.
Yeah, when anybody points to the outside of the knee or the outside of the hip, pretty good chance that we're talking about that broad band, and it spans the two joints because it goes all the way up from the crest down. And it's just really frustrating. Like your friends running, with plantar fasciitis, and you can't get rid of it, and it's really frustrating you because you can't do the things you want to do when you're out there. Could very well be IT band. And talk to a medical professional, a sports medicine person, and often they can show you things. The stretches are a little tricky. Did you do okay with the stretches?
I did. I used, matter of fact, I used my athletic band to try to stretch that out a little bit.
Yeah, perfect. So it's the kind of thing that runners learn to manage a lot of times on their by themselves. And so as so many of our kids are getting out running a lot, in every training room around town right now, there's cases of IT band. Go see your high school athletic trainer. Many times they can cure it. There is a handful of 20% or so not getting better, where we get them into formal physical therapy and watch the way they run and change their shoes. But you did all the right things, and Ray, keep that running career going as long as you possibly can.
I will. Joe, thank you for the insight, my friend. We'll catch up with you next week.
All right, Ray. Have a great week. Thanks.
There you go. Dr. Joe Congeni, Akron Children's Hospital, joining us live this morning.